All right, in this explainer, we're diving into some of the most critical tools in the operating room, the surgical gatekeepers. We're talking about clamping and occluding instruments, the unsung heroes that give surgeons control during incredibly delicate procedures. Let's get into it. So, picture this. You're deep inside the human body, surrounded by a complex network of vessels and ducts. How on earth do you stop the flow of, say, blood or bile without causing a catastrophe? It is a massive challenge, and one wrong move could lead to serious complications. The answer? Well, it lies in a very special set of tools. And that's the perfect name for them, the gatekeepers. These instruments are literally designed to open and, much more importantly, to securely close the gates on all these internal pathways. It's all about making sure every single procedure is as safe and as controlled as it can possibly be. To really get why these tools are so ingenious, we first have to understand the problem they're built to solve. It's all about maintaining absolute control in what can be a very chaotic environment. A surgeon is constantly juggling these three things. Controlling bleeding, that's the obvious one, right? But securing ducts to stop bile from leaking or closing off a part of the intestine to prevent spillage, that is just as critical. There's zero room for error in any of these areas. So, with that in mind, let's meet the instruments that make this level of control a reality. These are the tools that directly tackle those critical responsibilities we just talked about. At their very core, this is what they do. They create a blockage, plain and simple. But here's what's really interesting. That distinction between temporary and permanent. Sometimes you need a clamp you can take off later, and other times you need a seal that lasts forever. And you better believe there are different gatekeepers for each job. So we're going to break this down into the 5 main categories. Think of this as opening up the surgeon's essential toolkit for occlusion. Okay, so here they are. We've got clip applicators, endoscopic staplers, endoloops, bulldog clamps, and the super high-tech advanced energy sealers. Each one has a totally unique design for a very specific purpose. First up, one of the most common tools you'll see, the clip applicator. These are the absolute workhorses for simple ligation, which is just a fancy way of saying tying something off. When a surgeon needs to quickly and reliably close a small structure, like the cystic duct during a gallbladder removal, this is their go-to. But, not all clips are created equal. On one hand, you have your small, simple titanium clips. They're fantastic for routine jobs. But on the other hand, you've got polymer clips, like the Hemalock. These things actually have a locking mechanism, which makes them perfect for bigger, more critical structures where you need that extra layer of security. Now let's talk about a real multitasker, the endoscopic stapler. These things are incredibly efficient. Just imagine you need to seal 2 sides of a tube and cut it right down the middle. Well, a stapler does both of those things in one single action. It lays down multiple rows of staples for a rock-solid closure, and a tiny blade follows right behind to divide the tissue. And just like clips, staplers come in different shapes and sizes for different jobs. You've got linear staplers for long closures, like when a piece of the bowel is removed. Then you've got circular staplers, which are designed to create something called an anastomosis, basically reconnecting 2 tube-like ends. This is a huge deal in colorectal surgery. But what if you need a simpler approach? Well, meet the endoloop. This thing is the definition of simple elegance. It's basically a surgical knot on a stick. It's a pre-tied loop of suture that a surgeon can just slip over something, like the base of an appendix, and then just pull to tighten it down. It's effective, it's simple, and it's very inexpensive. And using it is just as simple as it looks. You introduce it, you position it, and you tighten it. That's it. It's an incredibly fast and effective way to ligate something. But hang on, what if you need the blockage to be temporary? That's where bulldog clamps come into play. The key words here are temporary and reversible. These are for when a surgeon needs to stop blood flow for a little while to do a repair, but then needs to get that flow going again. They're designed to be gentle, to clamp without crushing or damaging the delicate vessel wall. And finally, we get to the really high-tech end of the spectrum, advanced energy sealers. Devices like LigaSure or Thunderbeat don't just clamp things. They use a precise mix of pressure and energy to literally fuse the walls of a vessel together. It creates a permanent, super reliable seal, and they often have a blade built in to cut the tissue right after. And get this is just incredible. These advanced devices can reliably seal vessels up to 7 millimeters in diameter. That is a pretty significant blood vessel,
And being able to seal it permanently without a single clip or staple, that's a massive leap forward in surgical technology.
Of course, with tools this powerful comes a huge amount of responsibility. Using them safely is everything, and there are some golden rules that every single surgical team lives by. It all comes down to attention to detail, like you always double-check that a clip is perfectly placed before you make a cut. You make absolutely sure the stapler is fully closed before you fire it, and you never, ever use an energy device near a metal clip because that energy can travel and cause an unintended burn. These checks are just non-negotiable. And this rule right here, this might be the most important one of all. Hemostasis just means stopping blood flow. So after any vessel is sealed, the surgeon has to just pause, watch the area, and be 100% certain there is no bleeding before moving on. It's the final confirmation that the gatekeeper did its job correctly. Okay, so let's pull all this together and take one last look at the surgeon's complete toolkit for control. So there it is, the complete gatekeeper's toolkit. You've got your simple, reliable clip applicators and endoloops. You have the powerful staplers and advanced sealers for bigger jobs. And of course, the delicate bulldog clamps for when you need temporary control. Each one has a critical role to play. When you get right down to it, without these instruments, without the ability to reliably control vessels and ducts, minimally invasive surgery as we know it today just wouldn't be possible. They are truly the foundation that safe, complex procedures are built on. And that leaves us with a really fascinating question, doesn't it? As surgery pushes forward, becoming even less invasive, more robotic, and more complex, what are these essential tools going to evolve into? What will the gatekeepers of tomorrow look like? Now that is something to think about.